Today, in consultation with this group, I recommended we bring the President up to Walter Reed as a precautionary measure to provide state-of-the-art monitoring and any care that he may need. Just 72 hours into the diagnosis now, the first week of COVID, and in particular days 7 to 10, are the most critical in determining the likely course of this illness. At this time, the team and I are extremely happy with the progress the President has made. Thursday, he had a mild cough and some nasal congestion and fatigue, all of which are now resolving and improving. At this time, I'd like to bring up Dr. Dooley to discuss some of the specifics of the President's care.
Thank you, and good afternoon. I'm Dr. Sean Dooley, as Dr. Conley mentioned. I'll start off by mentioning how incredibly proud I am of our medical team assembled behind me, and the honor it's been to care for the President over these last 24 hours here at Walter Reed. He's receiving outstanding multidisciplinary care, the state of the science for coronavirus infection. We are monitoring him very closely for any evidence of complications from either the coronavirus illness or the therapies that we are prescribing to make him better. We have monitored his cardiac function, his kidney function, his liver function. All of those are normal. And the President this morning is not on oxygen, not having difficulty breathing or walking around the White House Medical Unit upstairs. He's in exceptionally good spirits, and in fact, as we were completing our multidisciplinary rounds this morning, the quote he left us with was, "I feel like I could walk out of here today," and that was a very encouraging comment from the President. Moving forward, I'll go ahead and introduce Dr. Garibaldi, who will talk about some of our therapeutics and the plan of care for today. Thank you.
Thank you, Dr. Dooley, and I'd like to echo the sentiment from the entire team. What an honor and a privilege it is to be part of this multidisciplinary unit to care for the President. About 48 hours ago, the President received a special antibody therapy directed against the coronavirus, and we're working very closely with the company to monitor him in terms of that outcome. Yesterday evening, he received his first dose of IV remdesivir, and our plan is to continue a 5-day treatment course for remdesivir. And the big plan for today, since he's in such great spirits and doing well, is to encourage him to eat, to drink, to stay hydrated, to be up out of bed, and to be working and doing the things that he needs to do to get well. And I'll refer Dr. Connolly to any questions.
Thanks, Brian. It's important to note the President's been fever-free for over 24 hours. We remain cautiously optimistic, but he's doing great. With that, one other note, it should be clear that he's got plenty of work to get done from the Chief of Staff, and he's doing it. With that, if there's a couple questions about the President's health in the last couple days.
Sir, could you tell us the President's oxygen saturation level, please?
Yeah, so the last saturation that we had up walking around, he was about 96%.
And he's receiving he has not received any supplemental oxygen?
He's not on oxygen right now, that's right.
He has not received any at all?
He's not needed any this morning today at all. That's right.
Do you have an estimated date when he might be discharged?
Well, I don't want to put a hard date on that. He's doing so well, but with a known course of the illness, days 7 to 10, we get really concerned about the inflammatory phase 2. Given that we provided some of these advanced therapy so early in the course, a little bit earlier than most of the patients we know and follow, it's hard to tell where he is on that course, and so every day we're evaluating, does he need to be here, what does he need, and where's he going?
What do you see as the probability that he will need supplemental oxygen going forward?
I don't want to put a percentage on that, but right now all indicators are that that he'll remain off of oxygen going forward.
And in terms of like blood clots, pneumonia, bacterial infection, what do you see as the risk on that front?
Well, we know that all of them are risks associated with this condition. He is receiving all of the standard of care and beyond per routine, international COVID protocols. So we're monitoring for all of that, but at the moment, there's no cause for concern.
You said he's fever-free now. What was his fever when he had one, sir?
I'd rather not give any specific numbers, but he did have a fever Thursday into Friday, and since Friday morning, he's had none.
Okay. And what was the date?
On top of the other antibodies?
I'm sorry?
Why remdesivir on top of the antibodies?
So remdesivir works a little bit differently than the antibodies. We're maximizing all aspects of his care, attacking this virus, multi-pronged approach. As the president, I didn't want to hold anything back. If there was any possibility that it would add value to his care and expedite his return, I wanted to take it. And the team agreed, and that's why we proceeded.
Doctor, what was the date of the president's last negative test?
I'm not going to get into all the testing going back, but he and all the staff routinely are tested, and so.
Doctor, what is the PPE protocol for President Trump receiving visitors and doctors?
It's the same as any hospital has. We have an area that's clean that you put your equipment on, and then beyond that, everybody is fully gowned up, masks, gloves. We're protecting ourselves and him.
Have you done a screen? Has there been any sign of any lung damage whatsoever?
We are following all of that. We do daily ultrasounds. We do daily lab work. The team is tracking all of that.
Has there been any sign of damage, sir?
I'm not going to go into specifics on what the findings of any
If
of
we just
that
put you down
are.
on one thing, has he ever been on supplemental oxygen?
Right now he is not on
I understand.
oxygen.
I know you keep saying
That's
right now, but should we read into the fact that he had been previously?
Yesterday and today he was not on oxygen.
So he has not been on it during his COVID treatment?
He's not on oxygen right now.
Has hydroxychloroquine been considered as a viable treatment option for the president?
We discussed it. He asked about it. He's not on it now.
And in
Doctor,
terms of symptoms, has he also experienced difficulty breathing?
No, he has not. Never did. He had a little cough. He had the fever. More than anything, he's felt run down.
Who is handling contact tracing? Is that the White House or CDC?
The White House Medical Unit, in conjunction with in collaboration with CDC and local state and health departments, are conducting all contact tracing per CDC guidelines.
When was the positive diagnosis made? You said 72 hours. That would put that Wednesday.
Yeah. So Thursday afternoon, following the news of a close contact, is when we repeated testing, and given kind of clinical indications that had a little bit more concern, and that's when late that night we got the PCR confirmation that he was.
Is there any clarity on how he became infected?
Not going to go into that. As far as his care, it's irrelevant.
Or when he became infected?
Yeah, we're not going to go into that. We're just tracking his clinical course and providing the best care we can.
Will President Trump have to stay at Walter Reed to get the 5-day remdesivir treatment?
We discussed that. Right now, if he needs all 5 days, that will likely be the course. But again, every day we're reviewing with the team his needs for being here. And as soon as he gets to the point where it's not a requirement, he may still need some care, but if we can provide that downtown at the house, then we will transition at that point, as long as it's safe and appropriate and the team agrees.
In addition to his weight, does he have any other risk factors that make him more at risk for sort of a severe case?
Well, not particularly. I mean, he's 74, he's male, and he is slightly overweight. Other than that, he's very healthy. His cholesterol is great, his blood pressure is great, he's not on medication for that. He's up and active. You saw his activity, the days leading up to, the long hours and everything else. He's able to handle it.
Can you provide other vitals like heart rate, blood pressure, and temperature?
So his heart rate is in the 70s to 80s. His blood pressure has remained where it's historically been during our physicals. 110 to 120 systolic. He's great. It's never budged. I've had no concerns there.
So why was the decision made to transfer him here?
Because he's the president of the United States.
And obviously, if doctors have found that the prone position is helpful for COVID, has he been in that at all?
No, he asked about that. He did, Thursday into Friday. He's been briefed by the task force and all the scientists for months, and he brought that up, as we were discussing his cough, and at that time his oxygen levels were okay, and we didn't feel like we needed to do it. We came up here, we discussed it with the team as well. We consider all options, but he has not needed any of that.
Why wasn't the First Lady admitted as well?
The First Lady's doing great. Thanks for asking. She has no indication for hospitalization, advanced therapy. She's convalescing at home. Thank you.
I'm going to try to pin you down one more time. I know you said there was no oxygen
Yeah,
yesterday.
I'm not,
Is that,
yeah,
does
he's
that
not
mean he
on
re-
oxygen
But did he receive
today.
any on, did he
and-
receive any on Thursday?
And he's, what's today, Saturday?
Saturday.
No, Thursday.
Okay, so no Thursday,
he-
no Friday, no Saturday. That's fine.
So
that was why we were confused.
Thursday, no oxygen, none at this moment. Yeah, and yesterday with the team, while we were all here, he was not on oxygen.
So has the president actually been admitted as a patient to this hospital?
The president is a patient at Walter Reed National Military Medical Center.
Is he on any steroids?
Okay.
Press, thank
Can you ask that
Thank you very much.
Last question?
Thank you.
Okay, thank you.
There you go. See if my mic's on. Yes, there you go. There was a update on President Trump's condition from his physician Sean Connolly and a team of doctors at Walter Reed Medical Center Saturday morning on that. Big thing is Trump is healthy, walking around, no oxygen, no signs of anything to be concerned by his physicians, no fever. He did have a fever Friday when he was admitted, and that you can take from that what you want, but he said his vital signs were great. His there seemed to be no condition. The First Lady was asked about her condition, and she's still at the residence, the White House residence, with no problems. There didn't seem to be any alarms or concerns among the doctor team that was there giving the briefing, and there were about 10 of them there. I think 3 of them spoke on that. Obviously, it's the President of the United States, so they're going to take a good, close look at that. But he said, other than his age and maybe being a little bit overweight, he's in perfectly good health. Doesn't seem to be suffering any ill effects. His oxygen levels are up in the 96% range, which is my understanding from the press conference, well within the normal range. He's not on any supplemental oxygen or anything else. So if you look to the part of it, there doesn't seem to be any concern. Now, obviously, it's the President of the United States. They're taking every precaution and probably want to get him back up on his feet. Said he's still doing work. There's no problem there. Everything is going well on that. He's still the President of the United States, still doing the job of President of the United States. And I'm sure they want to get him up and running, back to normal. And that was brought up a little bit on top of the broadcast, or the briefing, I should say, by the doctors. They indicate, they said typically it's 7 to 10 days on this. Is the period that it runs through. They weren't exactly sure, or did give an indication, or I don't know if they're sure, but they didn't give any indication when this actually started. We obviously know the positive test came in on Friday. Well, it seems like it. That's when the president announced it. Let's put it that way. On Friday, early Friday morning, and started us on this quest that we're on right now, going back and forth. But again, his physician said he's doing absolutely fabulous, and there's nothing going on as far as, or not nothing going on. I guess you could say he's got COVID, but there was no indication that there's anything serious happening on this on or about this deal. So there doesn't seem to be any cause for concern other than the normal deal, it looks like it's going to be a typical coronavirus case. You have some mild fever, you maybe have some sniffles, some coughs, a little bit of fatigue for a couple of days, and then you're done with it. And that's how probably 99.999% of the people who get COVID proceed. And this is just my opinion, and I've stuck to it from the beginning. I think we've done us much more harm trying to do the mask or trying to bend the curve or doing anything else. And I think we've prolonged, and probably I think history is going to show, increase the death toll trying to do this incessant mask wearing, locking down, social distancing, whatever. It's going to be back across the whole deal. Because spreading it out, spreading the curve, moving it out has caused this virus, I think, to have an incubation period a lot longer than it would have if it had you done it, run its course, and let it go. I think Sweden is going to be the one of the benchmarks of that. You take the hit, you do it, you get done with it, and then you move on. Peru, which had military lockdowns, the strictest lockdowns, has, if not the highest, one of the highest death rates per capita in the world. So I think the statistics, the real world statistics, and not statistics, the real world example we have of right now is that, most of all these procedures were actually unnecessary and may have been even harmful. So why are we doing it today? This is how it goes, and I think and this is how Mother Nature's worked for ever since a recorded history. It's one of those things, that every virus has its course, does its thing. Some of them are more dangerous than others. Some of them get to that. Some of them, like COVID, are just really not really serious for the vast majority of the people. For a very small percentage of the people, yeah, it's a very big 911 deal going on. So I think and I hope the Trump team, this is my recommendation, that they get out front of this. I hope the president gets out front on it and says, this is what's happening. There's nothing to fear. If you have COVID, coronavirus, COVID-19, or whatever, it's not a death sentence. You're probably not going to die unless you're in a very high-risk category, which is very, very, probably less than 1% of our population has anything to really sweat about the whole deal. And life goes on. And hopefully life will go on very, very soon, not after, not too long, very, very soon. Life as we knew it before March, I'm going to say in the U.S., but let's say 2020, before all this madness started. I guess you could say in January when Trump put the travel ban on China on that. So there you go. That's the update from the doctors. Again, Trump doing very well. He's not on oxygen. He doesn't even have a fever. His fever is gone. His temperature's back to normal after the second day of this, of testing or announcing testing positive and being admitted to Walter Reed Hospital. And everything seems, oxygen levels are fine. He's doing great. No indication or any cause for concern amongst his physician, led by his personal physician at Walter Reed, Sean Connolly, who did most of the news conference, and a couple of the others spoke briefly on it. But again, looks like everything's A-okay. I'm pretty sure, barring any complications or any turns, Trump will be back on the job of president of the United States, out on the campaign trail and doing what we all love from President Trump, is being Trump. And that's it for the October 3rd Saturday morning physician update on President Trump and COVID-19 and the continuing story on that. If there's any other breaking news, or that, we'll be back as we see fit. Going on this day, because I'm sure this weekend will be full of updates and things on the continuing condition of President Trump, and we will bring it to you as we receive them. So until then, see ya.